You tell me when you're ready.
Okay, I'm ready. Oh, is this season 2? Should we just?
Yeah, we can say season 2, absolutely.
Yeah, season 2, episode 1. Yay!
All right, episode 1, and we are going to be talking about something that I have almost no knowledge, but plenty of opinions, and it's medication. People going on medication for all sorts of things, like not sickness, well, not health sickness, but I guess mental sickness, right? Anxiety, depression, hypertension, or whatever else.
Anxiety, depression, obsessive compulsive, all sorts of mental, behavioral, and emotional health disorders and issues. Some that require medication management over long, extended periods of time, and then some not so much.
So some can be, and I guess we're going to get into it, but some of them could be where you take medication to kind of get things under control, I'm guessing. And then what? They recommend that you talk to someone, seek therapy, and then you get off of it? Or
you can taper off. So, of course, as a therapist, I believe the best combination is always therapy in conjunction with medication if you're taking medication. However, there are some people that will never meet with a therapist. They'll only meet with a psychiatrist, and they will be prescribed their medications and take those medications over extended periods of years, some for the course of a lifetime. It all just depends on what they're diagnosed with.
I know this is a really wide open question, but can I ask what your opinion is? Oh, that thing better not, if that does that again, I'm going to turn it off. So let me ask you this question, and I know it's a kind of a wide open question, but what is your opinion about assuming the person has to be on medication for a certain period of time? Is your thought, well, let's try, if you don't have to be on medication, let's get you off, because that's just that's one way to fix it, but if you could fix it, and I'm saying fix, it may be a wrong word, but think differently, see things differently, that would be the route to go without medicating yourself the rest of your life.
So I try to allow the client a lot of autonomy in those decisions, but I do like to empower them with the information and the knowledge that they need to make a wise decision. But usually I try and empower them with autonomy to say whether or not they're willing to take medication. Now, there are some exceptions. There are some exceptions where I will push for the person to start medication depending upon what their diagnosis is and what they're currently experiencing. So I'll say this. For instance, if you're coming to therapy and I've been seeing you for maybe a month or 2, and I see you making strides, you're trying, and things are getting a little better, but you're still coming to me, you're depressed, you're still not sleeping, you're still having difficulty forcing yourself to interact with people, do things, then I may say, okay, let's get you in with your doctor for a checkup and see what's going on medically, because is there something medical contributing to your depression that could help it be treated? Because that's even in our diagnostic manual, depression due to another medical condition. So if you're depressed, but it's because you have undiagnosed diabetes, undiagnosed cancer, undiagnosed hypertension, then those are things that you could attend to that would start to result in an alleviation of your depression.
Wow.
Yeah. However, you may also have clinical depression, which is a chemical imbalance in the brain. It's a neurological disorder. So you can come and talk to me for 10 years and you won't be cured. You will learn coping skills and management techniques, but the real help is going to be in the pill for you.
Wow. Wait, let's go back to something you said. So cancer, diabetes, and other things can cause, is it causing a chemical imbalance that makes you depressed? Or, because if you don't know you have diabetes or cancer, if you have it, I can see that being depression.
And everything in your body is off because of a foreign invader.
Wow, I never
So
realized
the
that.
way your body is metabolizing sugar, foods, everything, all of that, our bodies are machines.
Yeah.
Yeah, all of that can play a really significant role. And I work with a lot of patients that suffer from diabetes, and their family members come and they talk about what they're experiencing of the person, and I jokingly call it the sugar monster. because there is a certain set of behaviors that a lot of diabetics go through, emotional behaviors that really throws their family members for a loop. And that's because there's depression associated with diabetes. There's anxiety associated with diabetes, and the people are being treated for one thing but not being treated for the other. And so when I break it down and explain it to them, they're like, oh my gosh, that's exactly what my mom or dad are doing. And they're flying off the handle and they're just off the rails about everything. And I was wondering what's going on with them.
Wow.
And depression can mask itself as anger, irritability, exhaustion. So there are all sorts of things to look for. A lot of people have trouble with the idea of needing to take psychotropic medications just because they don't want to be over medicated.
Or medicated at all. You're like, I don't want to take a pill. There's nothing wrong with me. I just,
But what I try to tell people is that, psychotropic medication isn't just what people prescribe. It's alcohol. That's a psychotropic med. Caffeine.
oh, wow.
Yeah, street drugs. All of those things are medications, so to speak,
Yeah,
because
they
they
change.
will have an impact on your ability to think and perceive. So they interact psychologically.
Yeah. Well, hell, I think everybody will get the caffeine because I need my caffeine in the morning to get started.
Exactly.
Or don't talk to me before I have my coffee or something like that.
Exactly. Something that's going to change your mood and also impact your thinking and can have the impact of distorting your mind in any way. So I say that to say that oftentimes people are, anti-meds, but they do these other things and self-medicate and over-self-medicate, overconsumption of caffeine, overconsumption of alcohol, maybe turning to street drugs or illegal drugs or misuse of cannabis, all those sorts of things.
Yeah. So Lola, again, I know I'm asking questions that are probably incredibly complicated. I'm looking for a simple, average answer, but someone who has, let's use depression because that's a great example. Is there something is there any way you could test your blood that says, hey, your blood is off? Is there a simple thing they need to do? Number one. Well, let's just answer that first.
I'm so glad that you brought that up because a psychiatrist will submit your blood for testing to see what medications will work best for you.
Really?
And yes, and you will go under a complete psychiatric assessment to determine the extent and the origin of your depression. Because a person's depression can be situational based on things that are happening in their lives right at that moment.
Right.
Or it could be genetic and something that they've inherited and that it's biological and then it's triggered and set off by environmental circumstances, but the genetic predisposition is already there. And then you have other disorders that are serious mental illness like schizophrenia, schizotypal disorder, bipolar disorder, that in order to have a decent quality of life, you're going to be on medication. It's absolutely necessary.
Is there again, simple question, probably complicated. Is there a diet? Let's say, is there any way to have like certain foods that enhance your
overall functioning? Absolutely. And so here's where things get tricky. There are many alternatives to medication. There's TMS, which is transcranial magnetic stimulation. There's EMDR. There is ketamine therapy. There is psychedelic therapy utilizing ayahuasca and other psychedelics.
Wow.
All sorts of things that people can do, but it gets costly.
Got it.
So money and also a person's determination, willpower, and discipline go into a lot. Because if you're going to manage your depression or anxiety, keep in mind, everyone with these disorders does not require medication.
That's right. Yeah,
but if you're a person that requires medication but would prefer not to be on it, then you have to be very structured in how you're planning to live your life and in what you're going to do for yourself.
Wow.
Very disciplined. And pregnant women, it can be That's another caveat, because when a woman becomes pregnant, if you're a person with schizophrenia or bipolar disorder and you become pregnant and you don't necessarily want to be on your medication,
Right.
then you have to get with a clinician, a therapist, and a psychiatrist that knows about how to deal with a pregnant person and what sorts of things should they be doing for themselves if they don't want to be on medication. And that's really important. Now, there are classes of drugs out there that are safe to take while pregnant, but you can't blame a mom if she just decides, I don't want to chance it. I don't want to do it. And so then you have to come up with a plan for, okay, what does this look like? And then will you be nursing? How long will you be off of your medication? When to go off, when to get back on? It's a very nuanced thing.
So let's talk. Wow. So let's talk about some of the stuff. First of all, is there a most common? What's the word I'm looking for? Like depression is one thing, anxiety. Is there one of those that's most common with people, as far as the most commonly seen?
Most commonly acknowledged is anxiety.
Acknowledged.
Yeah. I think a lot more people are depressed than people want to say, but no one wants to go around saying, I'm so depressed.
Yeah.
People are like, I'm so anxious. But oftentimes they're intertwined. But anxiety, more so than depression, you will see diagnosed in greater prevalence.
Anxiety.
And people will seek treatment for anxiety because anxiety is really disruptive to your life. Depression can be disruptive, but even like the commercials for antidepressants show where the person is, walking around muddling through life, but they have the little smiley facade face. People do that. People get up and go with depression and sort of push through until it becomes very severe. With anxiety, on the other hand, people try to function, but it can be very, very stifling.
Really?
Yeah, because anxiety causes you to encounter illogical or irrational thoughts. And when a person tries to have a dialogue with people around them about these things, oftentimes people become very annoyed with the anxious person, or an anxious person overthinks everything, so it can make it difficult for them to complete tasks or even get started because their mind is trying to think of every possible scenario. And then it may even fall into the obsessive compulsive type, to where they're counting steps, or they're checking locks 50 times before they leave the home, or they get halfway down the street and believe they left a candle burning. And so all sorts of things. Anxiety is very disruptive, so people will come in and like, I'm suffering from all of this anxiety. People with kids, first-time parents, moms and dads, I see it with them all the time. They can become convinced that something bad is going to happen to their kid. Nothing's gone on to make them think this, but they just become obsessed and will think my child's going to be kidnapped, or they're not safe at school, and it becomes really difficult for them to be apart from their kids, and so they need help. Yeah, anxiety is very much prevalent.
So Lola, can you talk about some of the things outside of medication? Can you talk about just some of the things that have worked for your clients from seeing I'm going to word it this way, your perspective changes, but that's probably bad. But coming to you, talking to you without going to get medication, what are some of the things that may work for people?
So what may work for people is going to be a shift in mindset. And so that takes a lot of work.
Yes.
It's very hard to shift your mindset. And so therapy can be really effective in that way. Just like there's a plethora of medications out there, there's so many different modalities of therapy. Narrative therapy is, talk therapy. You come in, you talk about your life, and the therapist helps you glean new meaning and understanding to the various parts of your life, because you may come in with a view of your life as hard and difficult and unfair, and all of these bad things have happened to me. And the therapist isn't there to negate any of those things, but the therapist is there to get you to see the underside or the flip side. Well, how did that change you? How did that influence you as a human being? How did that strengthen you? How did it break you down? What can you do with that now?
Right.
Yeah, so that's really helpful for people with anxiety and certain fears or post-traumatic stress disorder. Exposure therapy can work in helping them face those fears by being exposed to things a little bit at a time.
Right.
That can be really effective. Cognitive processing therapy, being able to know when your mind is not working for you, for lack of a better word, when your mind is playing tricks on you.
There you go.
It's one thing for your mind to play tricks on you and you be unaware, but it's a game changer when you become aware that, okay, these thoughts are not real. Yeah. These things that I'm seeing are not real. The things that I'm hearing are not real. This delusion that I'm having, okay, other people are choosing not to participate in it with me because they know it's not real. And now I'm aware that I have these things happening and I can work on it more.
Can you give an example of things that appear to be real and then you realize, hey, this is, I mean, the first thing that would come to my mind would be something like, to me, it would be like a jealousy thing. And you realize there's nothing to be jealous. Why am I getting jealous? And you start thinking about all the facts about your wife or your boy or your husband or whatever.
Ding, ding, ding.
Okay.
You get it. You challenge yourself with what's real and accurate because you recognize, okay, this jealousy is irrational. It's coming from somewhere. Where is it coming from? And you challenge that with thinking about, okay, but my spouse is dependable, faithful, attentive, loving. So where's this insecurity and jealousy stemming from?
Right.
And you can pinpoint to sometime in the past, it may have been a romantic partner that betrayed or let a person down, or it could be a parent. It could be a sibling. It could be feeling as if they weren't chosen by a teacher. It can be anything. It can stem from anywhere, and therapy can help you identify the origins of those negative feelings.
Got it. And let's go back to depression, because that's, I guess, is that number two? What would be?
Yeah.
Yeah, because depression, you hear about that. Mm-hmm. And I only, because we talked about this on the last one, people committed suicide. I've had one person in my life that committed suicide, had no idea he was, you know. So depression is something that a lot of, you said it's easier to hide, or, and I say hide, is that the right word?
Yeah.
Because people will say, I'm just in a bad mood today, or you just think the guy's just always in a bad mood, or he's always down, and it's so easy to say, you know, why doesn't that person just why is he why is he unhappy? He's got this, that, and the other, but that has nothing to do with it.
And people do that a lot. People judge a book by its cover, and then on the flip side of depression, we want a person to be walking around in like a dingy robe and
right.
not taking showers and not eating and not paying their bills. We want it to be so extreme that you're like, we're really worried about Samantha, you know, that sort of thing. But if Samantha is still being well-groomed, going to work, smiling, talking to people, and she tries to tell her friends, yeah, I'm really struggling with depression, they don't care. They don't want to hear it.
That's
because they're like, oh, Samantha's VP at such and such place, and she makes this amount of money. What does she have to be depressed about?
That's
and so oftentimes people conceal their depression because they really do feel like people don't care or won't believe them.
Well, I have no reason to. I imagine you must look at yourself and say, and I've had these days where I get up and I just don't feel great. Not mentally. I mean, mentally I don't feel great, not physically. And I'm like, man, why don't I feel I have this? And sometimes, Lola, for me, I'll have to, because usually it's related for me to business. Because if I've had like a slow couple of days with leads, immediately you start thinking. And then I look, say, okay, what's in my, what do I have coming up? I know I have this coming up. I know these bills are covered. And then I start to feel a little bit better. But so I can acknowledge it. But I imagine there's times where you can't acknowledge why you feel down, and that may be a chemical imbalance or something else.
Or something else situational, or sometimes, you know, we're human. We can't feel 100% all the time.
Yeah.
We just can't. And then for some people, I know with women, a lot of women have severe PMS, which is known as PMDD. And for years, it was so taboo to even talk about women's menstrual cycles, and it was thrown around like an insult. Oh, you must be on your period if a
Right.
person is feeling a certain sort of way. But it's a legitimate medical issue that some people take medication for. Now, I do have clients with severe PMDD, and some of them don't want to take the medication. And so I tell them instead, okay, every time your PMS is about to start, you're going to have to treat yourself with extra special care. So we devise a plan that includes what work is going to look like for them. You know, are you going to save your sick days or PTO for this time of the month for yourself? What will meal planning look like? What will interaction with colleagues, family members, all of that. We put a lot of work into it so that they can function and make it through that time. Because for women with PMDD, typical PMS is 4 to 6 days prior to the menstrual cycle. For people with PMDD, they may have 1 good week a month.
Really?
Yes.
Wow.
1 good week a month, because the PMS typically starts for 2 weeks before their cycle, and then during their cycle, they may still experience irritability. For some people, brief psychosis is a thing. And then afterwards, they are fatigued and exhausted. Yeah. And then get this shot of this burst of energy where all of a sudden they can like exercise for 3 hours straight and stuff. It gets very complicated for a lot of women. So when they're unmedicated with PMDD, we do a lot of planning and hard work. And then I work with a lot of moms and their teenage daughters that seem to have PMDD, but of course they're kids, so the parents don't necessarily want to medicate them.
Right.
Yeah.
Yeah. And I'm assuming that once the woman reaches an age where she's no longer getting a period, does that end? Does all that end?
Well, then there's a whole nother set of issues from hormonal fluctuations. There's hormonal depression in men and women, because men have fluctuating hormonal levels too as they age, and you know, people's bodies are changing. Adults, as they age, encounter something called a shrunken world, and it's like your life gets so much smaller than it was in your 20s and 30s, because socially you know less people, more people are dying, people are aging and going into different areas of their lives, so there's just not as much community as we age. And so the shrunken world causes a lot of distress for people, because they just have a hard time connecting with others. And the hormonal fluctuations that women and men go through make it hard to connect with themselves, because they can start feeling like, I hear this from women all the time that are menopausal or perimenopausal, I don't feel like myself, and I don't even like this new person that I've become.
Wow.
Yeah, because they go from being free spirits to all of a sudden they find themselves being irritated, wanting to nag about stuff, and they recognize that these are changes in their personalities that were not there before.
Yeah.
And they're recognizing that they're having difficulty in their relationships with people, friends, colleagues, everyone else, because of these hormonal changes.
So I'm going to say something here, and this is really for the guys. Because as guys, when we hear a woman say that she's on her period, or will say that she's probably on it, which I know is horrible, she's in a bad mood because. So I was in one day, I was just irritable. And I was irritable because I just wasn't right. I was in pain. I just got off being sick, but I wasn't right, Lola. So I just wasn't myself. And my friend said as a joke, said, Rob, what are you on your period? And I said, dude. And then it was like a light bulb. Because when you're not feeling good, yes, you're irritable. Because again, as guys, we're thinking, just feel better. That's not really, when you really don't feel good, it's hard to just be yourself.
Yeah.
And once you get irritable and then somebody says something to you. So yeah, again, as guys, we don't see that, but we really, really need to kind of get that and understand that. And again, I'm not just going to say this quickly. I can't imagine being that way, feeling irritable on a regular basis once a month. And I know a lot of women go through that. Yeah, wow, okay. Are there over-the-counter things that women can take to kind of help, besides with the pain?
Absolutely.
Okay.
So Cerevital is something that I always recommend to my clients. Men and women can take Cerevital, by the way.
So what does that do?
It's a supplement, and it mimics the, is it HCG or HGH? Somebody out there, y'all can, let us know which one it is, but it mimics an important hormone in the body.
Ah, okay.
That reduces as we age. And so it mimics that, so you automatically feel better because you're getting that little burst of like youthfulness again injected into you. So it's a pill.
Yeah, but is it a supplement? Is it a natural, or is it a medicine?
It's natural.
It's natural.
It's
okay.
natural.
That's
Yes.
awesome. All right.
Yes, and so that's one. Amberin is a really good one for women as well because it works on all premenstrual symptoms as well as menopausal, perimenopausal symptoms, and it's over the counter.
Amberin. Is that what you said?
Amberin, like AMBEREEN.
That's not what's the sleeping one? Helps you sleep.
Ambien.
Ah, okay. That's
Yeah.
Yeah. Big
But
difference.
Amberin helps with sleeplessness as well because it has components that help with that. Then there's ashwagandha. That's really popular right now, and it really works. It works. And the gummies are delicious. Goli makes really good ones. So that's like a natural antidepressant. 5-HTP, it's natural. You can buy that over the counter. Different omegas are really good for depression and anxiety.
Really? Wow.
St. John's wort and valerian root are really good for anxiety. So there are some things out there.
When people come in to see you about anxiety and all this other stuff, I'm assuming this is all part of the conversation.
It is. I definitely always give clients a lot of psychopharmacology knowledge just because knowing sort of takes the fear out of things for people so they can decide for themselves at some point, okay, maybe I'm ready now. And this battered sheet that I have, every intern mentee that I work with, I always make a binder for them, and I include this sheet of psychopharmaceuticals, and I always include psychological terminology too for them so that they know all of the appropriate terminology, and then they know the background of the different meds. So there are antipsychotics, there's anti-anxiety, there's hypnotics, there's antidepressants, and then there's psychostimulants, anti-obsessionals, and bipolar disorder medications, and as you can see, it's a lot.
Yeah.
And this is just a page. They're whole books because there's some books out there on psychopharmacology that give you all of the, commercially produced medicines and then all of the plant-based stuff too.
Really?
Yeah. Okay, so antipsychotics are those medications to help when someone is experiencing a psychotic episode or they have a chronic serious mental illness where they're prone to psychosis, which psychosis is a break with reality. And you may hear, see, smell, experience things that aren't there. And so that's when antipsychotics are prescribed. And whenever I get a new patient, I always ask for a list of all medications because that part is really important. And it's important because you help the patient learn how to talk about their disorder without the veil of shame that some people have, because they'll tell me their medications. And then when I say, have you ever been diagnosed with anything in the past? No, I don't think so. But when you give me that medication list, I'm going to know instantly if you've been diagnosed with something in the past, because oftentimes people, and now keep in mind, just because a person is prescribed an antipsychotic doesn't mean that they suffer from psychosis, because some of these medications have dual or even several indications that they can be used for.
Right.
But if it's prescribed in a certain manner in conjunction with other drugs, that's going to be a signal that perhaps you've been diagnosed with this in the past. Let's talk about that.
Okay.
You'd be surprised how many people have seen a psychiatrist and are taking medications and they don't know their diagnosis.
What? So they go to a psychiatrist, the psychiatrist is helping them out, but they don't really know what their own diagnosis is. Is that what you're saying?
Yeah.
How can that be? I don't get that.
So sometimes they say they've never been told. I doubt that, but perhaps they were told and didn't ask a lot of questions, or didn't get a lot of information or follow-up on the actual diagnosis. Or for some, if they say they haven't been told, maybe they haven't been. I seriously doubt that, but that's the case for a lot of people.
Okay.
And I say, well, when you meet with your psychiatrist again, ask for your diagnosis. Ask to, talk about every single thing that you've been diagnosed with.
So
Yeah.
I would imagine there are people out there that they'll take whatever information you give them, and this is a cure, great, let's do it. And then there's a lot of people, I would think, that are out there, they don't want to hear or accept that they have either a chemical imbalance or, right?
Yeah.
So how do you deal with that?
Well, and you can see why, because there's still not as much stigma today about mental health issues, but there's still some stigma.
Yeah.
And so for people, it's really, really hard. And they may be in a family or a community where they're going to be deemed crazy, or people will say insulting things. And that can be really difficult for people to go through.
Yeah.
Yeah, it can be really difficult for them to go through. And what I like to tell clients and patients is that, let's educate your family about your diagnosis too. Bring someone in close to you so that we can talk to them about how they can best support you.
Got it.
And sometimes I've had the experience of having to cut a client loose because they need to be medicated because it's a matter of safety for themselves or others around them, and they refuse. So when they refuse to follow recommendations, then I refer them somewhere else, and I tell them, you're going to continue to be cut loose if you don't follow recommendations because you are so severe. Yeah, I've seen some things.
And so again, when I'm thinking about medication, I'm thinking a lot of it has to do, and you mentioned some already, but just your chemicals in the brain are off, and they're going to be off. And the only way to get that back, in many cases, is with medication.
In many cases, yes. But for some people, medication is temporary, and I tell people that too. You may be going through a really stressful time in your life where you're hypervigilant, so you're just so anxious and so on edge. You're in a consistent state of overstimulation. Now, for a lot of people, Rob, they don't feel that they have the ability or the luxury of saying, oh, I don't want to go to my kid's ballet recital, or I can't go to this event because it's thousands of people and I'm too anxious. They don't feel like they have that luxury. And so for that person, they may need to be on medication for a short duration of time until whatever situation is causing this overstimulation and anxiety ends. Maybe they've just moved to a new state, gotten a new job. All of these new things are happening and causing them a lot of anxiety. So they may go on medication for 3 months, 6 months, a year, and then start to wean off.
Okay.
And I think for a lot of people, they may try medication and then have a negative response. And so it scares them against all medications because some medications can make you suicidal and you haven't been suicidal before. Yeah. It's rare, but it does happen for some people.
So I can understand someone not wanting to be, because you don't want to say I'm on meds. Not that you're saying it out to the world, just to yourself. I have to be on meds. Because I don't know if it's self being proud. I don't know what the right reason is, but you don't want to be on meds, even if that's the only solution. If you looked at what I do like the natural. If there's a natural way, because okay, so lactose intolerant, right? I never wanted it because I didn't want to take a pill, and then I think it was my doctor said, "What do you?" He said, "Rob, it's not a pill; it's just a supplement." I didn't know that. I'm thinking, because it's just a body thing that your body's not making, so it's just a supplement. Well, once I saw it like that. Why little? I get silly, right? What does it matter if it's a damn pill or it's a supplement, right? I'm thinking, okay, it's natural.
You just felt better about a supplement.
Yes. It's like, why? I just need more bananas. Okay, great. I'll eat more bananas. But take a potassium pill, and then do I know it's a pill? It's so Yeah, I do understand why people don't want to, and also sometimes I imagine meds can make one thing better, but they may put you in a different mood, right?
Well, some people complain about feeling numbed out. And you got to keep into consideration, if you're a person and you're a feeler and you're used to feeling everything intensely and then that stops,
yeah,
that's alarming for that person. And for a lot of people, that's their creativity. And so they don't want to take the medication. And I say, well, this is when you need to talk to your provider and say, you know, hey, I'm feeling numbed out. I don't want to feel numb, but I do recognize the need for the medication. What is it that I can take, or can we lower the dosage? Just really be open about having a dialogue. A lot of people get very intimidated in the presence of their doctor, their psychiatrist, but I say, you know, they want to help you and see you win. So just say what it is.
that's good advice.
Now, I am cautious when someone comes to me and they're taking anywhere between 6 and 11 medications.
Oh, wow.
That can be some overprescribing, and I usually tell them, hey, let's get in touch with your psychiatrist, let's see what's going on, and let's see if we can get you a redo. Let's see if we can start you over, because this may have been great for 2 years ago with whatever brought you to a psychiatrist, but maybe now you're in a different space. Or maybe there's been some advancements in the medical world to where instead of these 3 pills, now you can do this 1. And so I like to keep people pushing and advocating for themselves and doing what they need to do. I've had patients that struggle with bipolar disorder and they start out on 7 medications and we get them down to 3 or 4. It's possible.
So Lola, here's a question that may be people out there also, because you keep talking about psychiatrist and then you. I always thought a psychiatrist was a therapist that can also prescribe medicine. So they have that medical background.
In a lot of instances they are.
But
in a lot of instances they are, but it's rare in today's time for a psychiatrist to spend 40 to 50 minutes with a client.
Ah, okay.
Yeah, talking. They want the person to go to a therapist, and then they will handle the medication part.
Wow, so they work in conjunction with you. I didn't realize that.
Right. The majority of my clients, I send to a particular group of psychiatrists, and that's because they do such a superb job of collaborating on patient care with me. I see a client, I'm going to send a report to them, let them know what's going on. They see a client, they're going to call me on the phone, leave a detailed account of what's going on with the client.
Yeah.
We collaborate back and forth. You know, clients have signed a release on both parts for us to be able to do that, and it's incredible.
Yeah.
And they prescribed from a reserved perspective. They only want the person to have what it is they need.
Wow.
And so I really love and appreciate that. And I'll say this, they do a lot to educate me. If I call this particular psychiatrist or one of the associates in his practice and I say, hey, this is what's going on with a patient of mine, or what's your insight on that? Or if I just see something on the news and I say, hey, I just heard this on the news, what's your insight?
Yeah.
They'll actually fill me in, give me a little more information, and I really appreciate that, because the more that I know in order to help my clients, the better I feel. Yeah.
Absolutely. Lola, on time, it's 2:23.
Okay.
So
trying to think. Okay, we may have to do a part 2, a continuation of this.
Okay.
Just because you may be surprised to learn that there are certain people in society that are more prone to being in need of medication than others are.
Excellent. And I'd also like in part 2, if you don't mind, talk about some of the things that people can do who are feeling anxiety, who are feeling depression. What's some of the things they can do to begin with What's the first step they can take?
Oh, yeah.
Okay, so let's think about that for because I have a whole bunch of questions on that.
Okay.
All right, well, this was great. This was part 1. Part 2 is coming out.
Yes, part 1, part 2 is coming up. Stay tuned.
There we go.